Welcome guys, today we are starting with a new chapter, Neoplasia. We have covered all the rest 7 or 8 chapters. So before starting this chapter, I have an announcement for you that we have USMLE notes and MBBS notes available. MBBS notes for every prof exam and USMLE notes for every step. If you will use these notes, I think so you will get higher ranks in your medical journey and your score will be higher as compared to other students. These UCMLE notes or MBBS notes, they are designed in such a beautiful pattern that they are prepared in multi-colors, like more than 4 to 5 colors. And in these 4 to 5 colors, they have mentioned one color for previous MCQs, one for upcoming MCQ, one is important for the clinical diagnosis, etc. Like this, like in that way, these notes are prepared. If you are interested to avail these notes, I have mentioned my link in the description box or first comment, and contact me and avail these copies. Let's start the chapter. Neoplasia. This is very important chapter for those students who in future have a goal to secure specialization in oncology. So neoplasia definition is abnormal mass of tissue growing spontaneously even after stoppage of the stimuli. Means normally, for example, this is a cell, this is a cell, this cell receive a stimuli, this cell receive what? Stimuli. Stimuli means growth factors, and then this cell grow, then this cell grow. When the cell is not receiving any stimuli, means not receiving growth factor, and this cell grow by its own, it means that there is abnormal mass. So abnormal masses of tissue growing spontaneously by its own even after the stoppage of the stimuli. We have break the stimuli, but still this tissue or this mass of cell is growing. It is the rational definition of neoplasia. Let's discuss the characteristics of any tumor. The tumor having two regions, one is parenchyma and one is stroma. The tumor parenchyma consists of collagen. Increase collagen synthesis of tumor parenchymal cell within tumor mass. When the collagen synthesis of the tumor parenchymal cell, it increases within the tumor mass, it is called dysplasia. Tumor parenchyma simply means that collagen, whilst tumor stroma means the region where blood vessels and connective tissue is present. So this is tumor parenchyma, consists of collagen, this is stroma. But when this collagen synthesis increases within the tumor cell, this condition is called dysplasia, and it is seen in pancreatic adenocarcinoma, a very important MCQ, and cholangiocarcinoma. The first characteristic of the tumor is rate of growth will be higher for the tumor. As we have discussed, the rate of growth will be higher. Why higher? Because it is growing by its own. So the rate of growth will be higher for the tumor as comparison to the normal tissue. So the nomenclature of the tumor is the tumor ending with oma, means seminoma, adenoma, carcinoma. Suffix. When oma comes in the name, it means it is a cancer. It is a cancer? No, it is a tumor. It is a tumor. Seminoma, adenoma, carcinoma. It is a tumor. So, but there is always exception. These two names, hematoma and choristoma. Hematoma, sorry, not hematoma. I am again and again using some different word because to switch your knowledge to the right path. All the tumors ending with oma are tumors, but there are some names that they end with oma but they are not the tumors. One example is hematoma and other is choristoma. Got it? Now let's discuss the hamartoma. Hamartoma is considered as a benign tumor due to chromosomal aberration, monoclonality of a tumor. What is monoclonality and polyclonality? It is very important. Monoclonality, if present, it is suggestive of tumor. If polyclonality is present, it is suggestive of inflammation or infections. Monoclonality means that there is a particular region, for example in the uterus, and there are same enzymes present. For example, normally this is uterus, and here are two enzymes present, G6PDA and G6PDB. Two types of enzymes are present. But when in the uterus one kind of enzyme is present, it is suggestive of a tumor. If both types of enzymes are present, it is not a suggestive of a tumor, but it is a suggestive of infection, inflammation, etc. Got it? So when all the cell having a same enzyme, it is a suggestive of a tumor and it is called monoclonality. And when there are different isoenzymes present, it is suggestive of polyclonality. Let's discuss this is a basic chapter, a basic discussion about neoplasia. We will discuss each and everything. Just first enhance your basic concept. Now let's discuss choristoma and hamartoma. What is choristoma and hamartoma? We have already said that choristoma ends with oma, but it is not a tumor. So what is meant by choristoma and what is meant by hamartoma? And there we have discussed hematoma. Always listen the lecture with full concentration. This is hematoma, this is hamartoma. What is choristoma? Tissue is normal at abnormal anatomical site. For example, this is liver, and here is the presence of a ori tissue or the gastric tissue, any tissue. So this tissue is normal. This ovary tissue or the gastric tissue or the small intestine tissue, whatever you can say, this tissue is normal, but this tissue is present at abnormal location. For example, this is ovary tissue. So ovary tissue is present at the liver. So this tissue, we cannot say it is abnormal tissue. This tissue is present at abnormal place. Instead of liver, it should be present within the ovary. So this condition is called choristoma. On the other hand, hamartoma means for example, this is the liver. Got it? And this is a liver tissue, but this is affected. Now this is abnormal tissue at its own anatomical state. This is a liver tissue, but it is abnormal due to injury. So when normal tissue is present at abnormal location, it is called choristoma. When abnormal tissue is present at its normal location, it is called hamartoma. I hope I made myself clear. Now, this was the first characteristic about rate of growth will be higher for the tumor, and then we have discussed suffix, monoclonality and polyclonality, choristoma and hamartoma. Now let's discuss mitotic figures increased. Increased mitotic figures can be seen in normal tissue also. Example, proliferating endometrium, intestinal villi, and bone marrow cells. So increase mitotic figures, it can be seen in normal also, but in tumor it is also increased. So one, rate of growth will be increased, the second one is mitotic figure is increased. So mitotic figures, this is typical and atypical. Typical means bipolar mitotic figure. Bipolar mitotic figures, tumor cell and normal tissue. Means that bipolar mitotic figures can be present in both tumor cells and normal tissue, but atypical can never be present in the normal tissue. Atypical means instead of 2 it having 3, it is always be a tumor, it will always be a tumor. So atypical mitotic figures will always be a sign of neoplasia. The number third characteristic, it is a very important characteristic, is a metastasis. Metastasis means moving, spread of a tumor to the site which are physically discontinuous with a primary tumor. For example, this is lung and this is heart. You can say this is, for example, this is heart. No heart. This is, for example, stomach. So both are discontinuous in relation to the anatomical relations. When the tumor spread from this from this stomach to this lung, it is called metastasis. So metastasis, spread of tumor to the site which are physically discontinuous with the primary tumor. So it is a sure sign of malignancy. Always malignancy will be present when there is a spread of the tumor, but exception always matter in the exam. Two exception, one is basal cell carcinoma of the skin, because the lymphatic spread is very rare, and second, a glioma. Glioma and basal cell carcinoma both are cancerous, but there is no metastasis. So malignancy with rare or no metastasis. How this spread, how the tumor spread? The tumor spread by three ways: direct spread, lymphatic spread, and hematogenous spread. Direct spread, mucinous tumor of appendix, rupture of the mucin, peritoneum spread, and then pseudomyxoma peritonei, means direct spread. From cavity to cavity, a direct spread is present. So metastasis means the tumor can be spread directly, or it can be spread lymphatically. Lymphatics means the most common route of spread is lymphatic, commonly seen in epithelial cancer. Remember, epithelial cancer, lymphatic spread is involved, but exception always matters, that renal cell carcinoma and hepatocellular carcinoma, they both are epithelial cancer. Epithelial cancer means carcinomas, they will end with carcinomas, but these two epithelial carcinomas, they are not spread by lymphatics, instead they are spread by hematogenous spread. And in hematogenous spread, they are involving connective tissue, so they are seen in sarcoma. Example, osteosarcoma, rhabdomyosarcoma, and the most common is embryona rhabdomyosarcoma, pleomorphic rhabdomyosarcoma, and alveolar rhabdomyosarcoma. The first two ones, they are spread by the hematogenous, while the alveolar rhabdomyosarcoma, it is spread by lymphatic spread. So I hope I made myself clear. So the three features, the first feature is the rate of growth will be higher. The second feature is the first rate of growth will be higher. The second one was the second feature was the mitotic figures will be increased, and the third was the metastasis. The fourth characteristic will be discussed in the later section. Have a good day.